Good morning. Welcome to another segment of That's Where It's At. I'm your host, Stacy Swimp. Today we have a very important show. We're going to be talking about the coronavirus, and we have a special panel that we're going to have for you today. We have three special guests in studio from Hamilton Community Health Network. And we're pleased to have with us Mr. Clarence Pierce, who is the president from Hamilton Community Health Network, as well as Stacy Sawyer, who is the director of marketing and communications. And we also have on the panel this morning Kimberly, Warden, an LPN, and also director of quality at Hamilton Community Health Network. And actually, this week we were scheduled to have two of our elected officials on air, but in light of the fact that we have an ever-evolving pandemic, we felt it was important here at WFNT here. I especially wanted to talk about these issues. There's a lot of panic. There's a lot of concern. I understand. I'm not here to judge anyone. I think it's a reasonable thing for people to be concerned when people have lost their lives and we have a number of unanswered questions. In fact, I saw just a moment ago, I had a notification to my phone. Apparently, the governor is issuing a closure of all restaurants and bars. And this is going to be with the exception of drive-through, I believe, and delivery. So again, I stress it's an ever-evolving situation that seems to be changing from day to day, hour to hour. Just last night, I want to say, I believe that we saw a change in the restrictions or the recommended restrictions of the Centers for Disease. Before, I think just 2 days ago, we had notification from the governor and even from the president. I believe they were talking about 250 people or less a gathering. But now, just last night, the CDC issued a new guideline that said that they're recommending that people not gather above the number 50. And so that could be subject to change today, tomorrow. And so I think it's important that we have these discussions and that we have a conversation that encourages, informs, empowers. And what we don't want to do is we don't want to get people upset, and we definitely don't want to focus in on the politics of the issues. I don't think that's important. I don't think anybody here thinks that's important. I think the people are important. And so let me just go ahead and introduce our guest. First, we want to welcome to the show Mr. Clarence Pierce from Hamilton Health Community Network. Mr. Pierce, welcome to the show.
Well, thank you. I'm happy to be here with you and to get this very important information out to your listeners.
Absolutely. And also, let us welcome Miss Kimberly Warden, LPN, Director of Quality at Hamilton Health Community Network.
Thank you. Thank you for having me.
Absolutely. And finally, but certainly not least, we have my namesake here, Miss Stacy Sawyer from Hamilton Health Community. And I'm laughing for, she's a director of marketing and communication. The reason I'm laughing for, first of all, let me just welcome her to the show. Stacy, welcome to the show.
Thanks for having me.
And the reason I'm laughing is because the last 2 days, when I first started talking to her, when I saw she had the same name as me, you can tell I have a 4-year-old child because I went Dr. Seuss on her. And, like, hi, Stacy, this is Stacy. And every time I talk to her, I would try to make it rhyme. So, like, excuse me, we haven't even met yet, and I'm being goofy, so please forgive me. Well, it's been fun, Stacy. So let's jump right into it, and I'm going to start with Mr. Pierce. I'm going to start because he's the CEO. We cannot not start with the CEO of the company. Ladies, are we in agreement? Can't get these ladies in trouble. I'm just joking. Mr. Pierce, have you ever seen anything like the coronavirus? Have you ever heard or seen anything like this?
No, we have not, Stacy. We haven't even seen anything close to the response we're getting with the coronavirus. We have had a couple of incidents in the past, but nothing on this level.
So you heard me start off by talking about the school closings and the restaurants. What do you think? What are your thoughts as to all the school closing and restaurants that we're seeing taking place?
Well, I think it makes sense because, you want to limit the contact between people, because that's how the virus is spread. And so the more we can limit that contact, the better we can get a handle on this thing, and hopefully we can start to make some inroads and eliminate it.
And of course, Hamilton itself has workers, right? And so,
Yes.
and so,
Yes.
how do? What about your workers? What kind of steps is Hamilton Health Community Network taking to keep your own workers safe?
Yes, well, mainly, we want to make sure they have the appropriate equipment, masks and shields and things that we need, so that we can keep them safe. That's critically important for us and our staff right now, and we're doing everything we can to get that type of equipment and get it out to our staff, because working with our patient population, and many people are concerned. They're coming in, and having that equipment for our staff is very important for them and their families. So it's important that we have the things they need to do a good job.
Absolutely. I'm very certain your workers are very appreciative of the fact that you can, and it's important because a lot of times businesses or health professionals or organizations can reasonably so, rightfully so, be so focused on the at-large community that we might not pay attention to the rest who's sitting beside us,
Right.
as much
Yes.
as we should. And so to hear that best practices and your own workers are just as important to Hamilton is very important. And I'm sure
Very
your
much,
workers
very
will be
much.
very happy to hear
Keeping
that.
the workers safe is our first priority.
Absolutely. Thank you so much for that. We're going to weigh in with Miss Kim Warden. Kim, what is the coronavirus? So now it's an acronym, is COVID. How is that properly pronounced? COVID-19.
COVID-19, it's a coronavirus. It's a SARS type of virus. It's respiratory. Influenza, you go in surfaces you can touch, you can get ill. This is respiratory, so a 6-foot distance. If you're closer than 6 foot, then you could possibly be infected. So it's respiratory droplet.
Closer than 6 feet.
Correct.
Wow. How does the coronavirus spread, and what are the symptoms?
So it spreads respiratory, and the symptoms could be a dry cough, shortness of breath, fever, possibly a headache. We are seeing some cases with gastrointestinal symptoms also reported.
I see. And how long does it take for the symptoms of this virus to appear?
They're saying the incubation period is around 2 to 14 days. Some people may not have symptoms at all. Some people, it might take 2, depending on the immune system. Some it might take up to 14. So that's the 14 days, quarantine we're looking at.
Once someone has already tested positive for this coronavirus, what now? I mean, is there any treatment? Do you have any idea what happens after that?
So we don't have a medication for COVID-19. What we are is treating symptoms and any secondary infection like pneumonia. So what we're asking people to do is, if you have these symptoms, report it to your healthcare provider, and they will make a decision based on treatment based on your symptoms.
Now, Mr. Pierce was talking about how you guys are going about your business to protect your workers. What about the people that are coming to your clinics? Are there any restrictions in place for the visitors who are coming to the Hamilton Health Clinics?
So Governor Whitmer just had an executive order go out yesterday where we are limiting visitors and guests into the clinic. And so the patients coming into the clinic can bring in such as a parent or a guardian or a caregiver that needs to help with activities of daily living. Say someone's in a wheelchair, then we're allowing them to have a visitor, but we're screening everybody.
Hey, listen, folks, you've gotten a lot of information already in a very short period of time. And so what we're going to do is we're going to take a quick station break here at WFNT 1470. That's where it's at, and we will be right back. Hey, welcome back to That's Where It's At. I'm your host, Stacy Swimp. And we still have here in studio with us an amazing panel of representatives from Hamilton Health Community Network, Mr. Clarence Pierce, who's the CEO. And we have a wonderful LPN here. We have Miss Kimberly And we also have Stacy Sawyer here, and Kimberly Warden. And so we left off, and we were talking about some of the restrictions, I believe, of visitors coming to Hamilton Health Community Center, and Kim was weighing in on that, Miss Kimberly Warden. But Mr. Pierce, you had some thoughts on that as well.
Well, yes, and I think that we want to restrict the number of people coming into the clinic for a visit. Ordinarily, we would not have any restrictions. We would allow other family members to come in with the patient. But under the circumstances, we want to limit that contact with people coming into the waiting room so that we don't spread the virus if it happens that anyone have it. So that's why we're just requiring the patient to come in, preferably by themselves. But if there's some specific reason that they need someone, like an elderly patient, a disabled patient, a child, then we would certainly understand that and waive that so that they could come in with the patient.
And in some instances, they themselves may need to be brought in.
That's correct. That's always
They might not
a
have
possibility.
transportation or.
Yes.
Right.
Mm-hmm.
Well, thank you for that. So we're gonna ask some questions of Miss Stacy Sawyer. She's been sitting over there thinking she's going to be left out. Not going to happen, Stacy.
We can always hope.
So, Stacy, what can residents do? What kind of best practice? What can they do to help protect themselves?
Well, I think the most important thing is to self-distance. We're hearing that new term, self-distancing. And, it's for the safety of everyone. And it's very important. It's not hype. It's not overreacting. It's the way that we're going to stop this thing. And so by self-distancing, stay more than 6 feet away from each other. And, don't go anywhere if you don't have to go anywhere. Stay home. And, wash your hands. Use disinfectant, soap and water, wash for 20 seconds with soap, rinse for 10. Practice good hygiene.
As I was listening to you, I was thinking to myself, most of us have been taught all of our lives. It's like we're having to be told to go back to the basics. I mean, I'm not trying to be judgmental or insult anybody, but not just today, but just in general, as I've been hearing about what we can do to protect ourselves, I was thinking, man, my mama used to tell me that when I was a kid, and I'm 51. I'm old as Methuselah, okay?
Right.
And so it seems like we're having to be reminded and to remind each other necessarily to get back to the basics of cleanliness and good hygiene. Is that what's going on?
I think that's part of what's going on, but the other part is just being considerate of your neighbors and the other people in the community, because even though you might not be sick, you might not have any symptoms, it doesn't mean that you're not spreading it. Mm-hmm. So because people that are being tested are obviously the ones that are having the symptoms, and you could have the virus and feel fine, which is kind of scary.
Mm-hmm. So one of the things that you talked about in terms of prevention is just kind of staying at home. So a term that I've been hearing a lot, or a term I've been hearing used a lot, is social distancing. Social distancing. And I think another thing I've been hearing is another term called flattening the curve. Mm-hmm. Flattening the curve. Are you familiar with those two terms? Mm-hmm. Can you kind of elaborate on those?
Well, the social distancing is staying more than 6 feet away from each other. So we're obviously kind of breaking that rule right now, but we're all healthy.
And by the way, if anybody in this room sneezes, it's all over. The show is over. We're out of here, folks. I'm just telling you, And I'm not trying to make light of the virus. I'm talking about, taking care of me right now. If anybody in this room sneezes, it's all over.
Right. And as for flattening the curve, so,
right.
Like I mentioned earlier, people are really thinking, oh my gosh, this is just overreaction. It's not overreaction, because by distancing ourselves and staying home and using good personal hygiene, that is what's going to flatten the curve. So you can look at the other countries, like Italy for right now. They didn't implement these rules right away. And, they're in a very, very dire situation right now where they are literally deciding who will survive. And, it's kind of based on how old they are. And so if you're elderly, your chances, you're going to be made comfortable, but there's not much that they can do. And so the reality is we could get to that situation. I mean, we closed the borders as much as we could at the time, but who knows if it was enough. And, spring break is coming up. And so everybody wants to get on the plane and go to Orlando. Hello, I did. It took a lot of convincing from Kim and some of our other doctors that, no, you're not going to Florida. You're not getting on a plane. You're not driving anywhere. You're just going to stay home. And, it's better to be safe than sorry, because we do not want that happening.
An ounce of prevention is a pound of cure, isn't it?
Yes.
Part of what we're seeing when we start talking about social distancing, isn't it some of these restrictions and bans we're seeing by the state and by the federal government a part of that social distancing? We're talking about closing down restaurants, bars, schools, daycares. I saw this weekend there were a number of churches that still had the service, and I'm not here to judge anybody, but I was glad to see that my church actually had online services. They decided not to take that risk because we really don't know how bad this is yet, do we? I mean, I saw a press conference. I've been watching each of the press conferences, quite frankly, from the president, and there was a coronavirus task force, I believe, that was there with the president and the vice president. And as I said, this is an ever evolving, situation. We're getting more new information, right? Day to day, week to week,
minute to
minute, minute by minute.
Really?
So one of the things, and you can help me and help us with this. One of the things that I'm hearing is that we really don't know how bad this is yet, because I don't think there's really been a great deal of testing, if I'm correct. Is that right?
That is my understanding. Kim can probably speak better to that, but it's true. We don't know how bad this is going to get. And so that's why all of a sudden, everything is closing. Restaurants are now only serving carry out or delivery. You're going to see, in Seattle, my aunt lives in Seattle, and she and I were talking this weekend. The only things that are open are pharmacy and grocery stores. Everything else has been ordered to close. Well, in hospitals, obviously. But, it's these towns that are really hit hard. They are ghost towns now, and nobody is out and about. And so we don't want that to happen here in Genesee County or Michigan or even the country. And so that's why it's so important to take the steps now, have a little bit of pain now, so it's a little bit less painful later on, because we don't want a lot of deaths, and that's what we're really dealing with.
Miss Kimberly, Miss Warden, if someone wanted to get tested, how do they go about doing it?
First, you should call your healthcare provider. If you have any of the symptoms, definitely call them, let them know what you're experiencing, and let them make a decision based on your risk.
So then, Mr. Pierce wanted to weigh in. Mr. Pierce, you want to weigh in on that?
Well, I think, too, Stacy, if they have any symptoms, that is the key. If you are coughing, if you have a fever, then that there's a likelihood something is going on.
Well, you preempted me, because that actually was my next question: is who should be getting tested?
Mm-hmm.
So it's Mr. Pierce. So you're saying if someone is coughing,
yes,
sneezing, has flu-like symptoms, don't make any assumptions. You're saying about
Right.
what it is. Don't take any chances. Go ahead and get tested. Is that what both
contact
you
your provider?
Contact
your provider, and they can give you direction on what you should do next. Because some of this can be dealt with at home, but we need to know to some extent how severe the case is.
Miss Warden, you want to wait?
I agree. Mr. Pierce said it great. That's exactly what you want to do. You want to first, if you have the symptoms, not everyone should just be tested. We need to focus our efforts on those that are frail and at risk first, and then go from there.
So when you say those who are frail and at risk, elaborate on that. What demographics are frail, or what demographics would you say are at greater risk? For example, I saw, I think the CDC said that people over 60,
65, those with chronic conditions such as chronic cardiovascular disease, those with cancer, those with asthma, COPD. If you have any of those conditions, you should probably alert your primary care provider or your provider.
All right, folks, we're going to take another station break here at That's Where It's At, and we'll be right back. Hey, welcome back to That's Where It's At. I'm your host, Stacy Swimp, and we still have with us in studio Mr. Clarence Pierce from Hamilton Health Community Center, and we have Miss Kimberly Warden, and we still have Miss Stacy Sawyer. Now, before we went on a break, I was speaking to Kimberly Warden. I want to elaborate a little bit more on that at-risk, Kim, the at-risk population, because there are a lot of concepts out there. And I think we have to be careful as to also where we're getting our information, because everybody's got an opinion. And Facebook, by the way, folks, be careful what you believe on Facebook. I believe everything I read on Facebook, right? But of course, no, I'm just joking. So when you're talking about at risk, I heard you talk about older people, but what about younger people? For example, I've been looking at the numbers, and I have seen where most of the cases we have. In other words, we haven't really seen a lot of cases with people under 19. It looks like, right? But that doesn't necessarily mean they're not at risk or they're not vulnerable, right?
We're all at risk. We're all at risk for getting this disease. It's just more prevalent in the older folks that are actually, harming them. Anyone can get the virus, but who has symptoms of the virus, or it might be, detrimental to their health, that's what we really are watching, those frail and at-risk populations. So anybody can get it, and then we have to do our due diligence to make sure that we don't pass it on to an elderly parent, or maybe even a child.
So we need our young people paying attention. We need our young people understanding that they too have to exercise best practices, because they also can contract this awful disease.
That's correct.
And what about, like, for example, I have a soon to be 4-year-old child. He'll be 4 years old in just a couple of weeks. So what about the elementary school? He's in preschool, elementary school. What about the elementary school kids?
So, you could be out in public and not practicing social distancing, and then you come home, and you're bringing it home either on your clothes, in your hair, things that you've touched. And so you want to take precautions not to bring it home to a child, to an elderly parent. And so, what I'm telling everybody at work is when you get home, change your clothes, change into clean clothes, take a shower, wash your hands. Practice those hygiene practices so you don't bring it home. But everyone should be concerned right now. So we don't, and we don't see that curve go up.
I want to come back to the testing discussion, Kim. So once a person does go and get tested, how long does it take for those results to come back?
48 to 72 hours.
That's pretty quick.
It is. We're getting quicker. We would love to see a rapid test be implemented as soon as possible, where you can see maybe a 3-hour window.
3 hours?
Yeah. Right now we test in the clinic. It's a screening for influenza A and influenza B. It's a 5-minute test. So once we get more information, we can, companies out there can start, manufacturing these rapid tests, and then we can test more people.
Is there a precedent for that? Is there an example out there already of a rapid test?
Just the influenza test.
But none for COVID.
No.
And that's anywhere in the country that you know
That's
of?
anywhere in the country that I know.
Okay. All right. We're going to come back to Mr. Pierce. Mr. Pierce, one of the things that we see with the grocery stores, Walmart, Walgreens, is an absolute overwhelming of citizens going into these places and stripping the shelves of everything that they have. And I actually talked to Walmart the other day because they ran out of some things that I was looking for, and I called and asked them how long it would be before they would restock, and they said, we don't know, because they said their suppliers were out of resources. And so as I was thinking about our panel this morning, I asked myself, I wonder if Hamilton Health Community, are you concerned about the shortage of medical supplies or medications for Hamilton?
Yes, we are concerned about it because it does spill over into our suppliers and our manufacturers. But it's concerning when you see the citizenry going out, stockpiling a lot of these things that we all need. And, it's important for us to make sure that our neighbor also has the ability to purchase these supplies, because if they're sick, at some point it's going to impact us, no matter how many supplies we may have. So we want to make sure that our neighbors are getting the things they need as well as us. And this is not like some kind of natural disaster where you can't go out. You can go out. You can go to the grocery store and the pharmacy. So there's no need to rush out and stockpile all of these supplies. Yes, so we would hope that people would calm down a little bit and think about your neighbor. Think about the people who are, family members, friends, and what have you, that also need these supplies, and make sure that they are able to get those supplies as well.
So we do need to have empathy for one another. We need to have compassion,
yes, absolutely,
on each other and remembering our neighbor. Yes. And that's interesting because that was one of the things that was addressed in the press conference that I watched with the vice president and the president of the task force. I remember Vice President Pence saying that he was asked to speak to that issue. And he certainly brought it up during the press conference. He said, hey, we understand people are concerned, but he said, please just, get what you need for a week or so,
right,
and give other people an opportunity to get supplies, and give the stores an opportunity to to replenish their resources. And that's a great point. I hope people listen.
I do too.
I hope people listen,
yes,
and because it's especially with our seniors. Because many of them, yes, can't get out to the stores as often as maybe some of the other ones, some of us can. And so we want to make sure that we're thinking about them, and maybe even looking at ways to serve our neighbors.
Yes.
Maybe looking at ways to serve our seniors, maybe purchasing supplies and delivering them. I've been thinking about this and talking to other people. I know that I posted on our church website this morning that I wanted to offer myself if anybody needed help getting prescriptions. I'd go and pick them up. I'd make myself available, for seniors who are shut in and so on. So we need to be. That's a great point. This is a wonderful time for us to practice serving one another. Wouldn't you agree?
100%.
Serving, yes, one
yes,
another, and throughout the annals of American history, that's been one of our hallmarks. Generally, when we've had disasters, be it disease, be it war, be it the World Trade Center, whatever happened, generally we have a great resolve in our country.
That's right.
And we've always historically
always come together.
We always come together, and I hope that this would be no different. Would everybody agree here?
Yes, very much.
So, Kim, Ms. Warden, do you have any idea currently the numbers that we're looking at for Genesee County at this time?
So Genesee County right now, we have no cases confirmed in Genesee County. Yes. Yay.
Yes, that's a good
I know
thing.
there's been testing done. But in Michigan, we are looking at 272 negative cases right now, and this is changing every minute.
Yes.
53 positive, 30 pending. So it's the pending that we're really waiting on, and 809 that are called referred monitoring.
So I heard something, and I haven't had an opportunity to confirm it myself. And you notice I say I don't rely on everything I see on Facebook, but I've heard something about a student at Carmen Ainsworth who has been exposed. Are you familiar with that case?
I have heard, but I don't have any confirmation yet. No confirmation. So I'm looking at the Genesee County Health Department website, and I'm looking at the Michigan.gov website, and that's where I'm getting my information from. So I think it's if they're testing. They always call them presumptive, so I haven't heard anything about positive yet.
Now, it's interesting. You just mentioned the website. So let's talk about that for a moment, because we do need to be careful about where we get our information, don't we?
Correct.
And as the president says, and folks, don't start accusing me of being a Trump supporter or whoever supporter just because I quote the man. but he uses this term, fake news. So there is quite a bit of fake news out there, isn't there, as it relates to this issue?
That is correct.
Now, so can you kind of help us, direct us? What are one or two or three sources that we can feel good about in terms of where we're getting our information from?
Michigan.gov/coronavirus. That will bring up resources for healthcare providers, families, daycare, is also healthcare workers, and that's a great resource. It'll send you to the CDC websites that have all kinds of information about supplies, testing, who should get tested, symptoms. It's just great coverage on it.
You talked a little earlier, Kim, about people who are vulnerable, people who are 65, people who have chronic conditions, pre-existing conditions, right? So can you explain a little bit more, just so that people are clear, what exactly is a pre-existing condition?
So anyone that has a condition that might put them at risk, such as cancer, high blood pressure can put you at risk for certain things. The elderly can put you at risk. If you have upper respiratory conditions such as asthma, chronic obstructive pulmonary disease, any genetic condition that your immune system might not respond to a virus. Some people are transplants, where they've had a heart transplant, lung transplant, kidney transplant. Those are put at risk because of the medications that they take. So some people on medications always have an at-risk for certain viruses or illness just by the way their body can fight off a virus or an illness.
One of the things that I've noticed when I've been out is at least half the people that I'm seeing are wearing masks. I'm talking even a week ago or so. I went to the grocery store and there were a lot of people wearing masks. And I started asking myself, should I be wearing a mask? and again, you have all these different sources out there. So what I want to do, actually, I'll tell you what, let's take a station break, and then let's come back and talk about with the mask. Should we or should we not be wearing masks? Folks, we're going to pause now. We're going to take a station break here at That's Where It's At. I'm your host, Stacy Swimp. We'll be right back. Hey, welcome back to That's Where It's At. I'm your host, Stacy Swimp, and we're still continuing our panel discussion about the coronavirus, and I'm delighted to have in studio Mr. Clarence Pierce, still here from Hamilton Community Health Network, Ms. Kimberly Warden, and Ms. Stacy Sawyer, and we've covered a number of issues, and hopefully we've been able to answer a lot of questions that people have that have been unanswered, and I tell you what, we're going to continue the conversation. We were right before the break. We were talking about the mask, because I know that each place that I've been around the community, I see people wearing masks, and I myself have not began wearing masks, but I do have some masks that I've had forever, actually. and but I want to ask Miss Kimberly Warden to weigh in on that. Wearing masks, should we all be wearing masks?
No, that's not necessary. It actually cannot help you or cannot keep you from getting the virus. Your eyes are still uncovered. So if someone coughs within that 6 foot and the respiratory droplets go into the air, you can get them in your eyes. So you certainly can get sick that way. What the mask should be used for are people that are already ill. So if they're coughing or sneezing, it's going into the mask and protecting everyone else. If you're using up all these masks also, it doesn't leave them for the people who are sick. So we're going to use up our supply, and then we have to worry about that.
Okay. So I don't need to go online and spend $100 for these special masks. I've seen people doing this.
Right.
I mean,
right.
I've seen people. I have a friend of mine that told me he went online and spent like $100 and something for some special mask. I forgot what it was called, but he said he spent over $100 for a mask.
A respirator mask.
Is that what that is?
Yeah, and some masks that you can buy at Home Depot, those are only for dust particles. They're not for respiratory droplets. So every single mask you see is not going to protect you from this.
So he basically just wasted his money. Sounds like.
He may have.
Yeah.
Oh wow! I said, man, you could have invested that into a local charity, man. I'm gonna tell him that too after the show. I'm say, hey, listen to the podcast, man. You don't believe me, but you hear it straight from the horse's mouth. You could have donated that to a charity. One of the things that I want to talk about is what should we do, or rather, when should we stay home? When should we stay home?
If you're having the symptoms we're talking about, fever, cough, sore throat, stay home. This might be a minimal, a disease process for you, and we won't overwhelm our healthcare facilities. But those that are at risk, those that are, over the age of 60, 65, those that have chronic care conditions, if you get a respiratory condition, that might put you at risk for even more harmful, symptoms. So that's when you want to call your healthcare provider.
Well, I do want to ask you, Kim, how bad can this thing really get?
We don't know. I mean, we really don't know. United States, we're at the start of this. Italy, they've been at it a little bit longer, and look how bad it got. So I think taking the precautions now is going to help it not get that bad.
So when this is all said and done, I mean, how do we get back to normal, or will there be a new normal? Will there never be a normal like what we've had before?
Well, that's hard to tell, but I think this is going to really bring up hygiene and how to keep from getting sick. Even with the regular flu virus, we just hear flu a lot more, but I think people are going to be more aware of not passing on viruses and illness to other folks.
Stacy, I think this will pass. We will get over it at some point, but I think we have to be cognizant of what's going on now and make sure we protect ourselves and try to get a handle on this thing, because it's going to be important over the next probably month in particular. We haven't been testing, and once we start, the hope is we don't have a balloon of cases that we just didn't know about, and now they're presenting themselves. So I think to get on it now is a good thing to do.
I want to ask before we run out of time. I want to come back to Miss Stacy Sawyer, and we've had a lot of discussions about family, Stacy. Mm-hmm. I wanted to get you to weigh in on some of the thoughts that you've shared with me about family, your concerns about family.
Well, people are talking about, oh my gosh, my kids are at home, and what am I going to do with them? It's better to have them at home and have them healthy than to have them out at the school and have them exposed to hundreds of other kids and other parents and teachers and so forth. So I have a fifth grader at home. They sent home a huge packet. So they're continuing their education as well as they can. There's also a lot of free educational platforms. A lot of platforms offered free service. So, I mean, not to plug anything, but I know ABC Mouse is out there and they're free. And so my kid's on there today, So I think it's important that we continue with some sort of education and some sort of routine for our kids to make it as normal as possible. The one thing that I told my son is this is not a vacation. This is you're continuing to learn, and, you're just going to learn in a different way. But we also, lots of experts are saying to create a routine. You get up in the morning, you get dressed, you do some schoolwork, you go outside, you get some physical activity in, you come in, you eat your lunch, and you go back to the books. And so I think it's important to be able to do that, but also make sure that you're there for your kids, because, there's a lot of fear. These kids are scared. This is, obviously not normal. And so I think just as long as parents can calm fears and talk about it with their kids and reassure them that we'll get through it. And obviously this is a great time to practice personal hygiene and teach your kids how to wash their hands, to make sure they're covering their mouth when they cough and sneezing. And so obviously take this time to talk about the importance of all of that.
Well, you've heard it here, folks. We've covered a lot of issues, and before we run out of time, I want to ask Mr. Clarence Pierce, you have any parting thoughts?
Well, and just to deal with that same issue, kids, not going to school is, I think, a good decision, because, as kids pick up things at school, they take them back, they visiting, grandma, papa, and we don't want them to contract something just by happenstance. So I think it's a good call to shut the schools down, let this thing play out, and hopefully we'll be able to stop the spread.
And finally, I want to ask Stacy or Kim, whichever one of you ladies want to answer this question. Where can our listeners find out more about Hamilton Health Community Network?
You can find out more at hamiltonchn.org. We're also on Facebook at Hamilton Community Health Network, Twitter. We're everywhere.
You are everywhere. And by chance, is there a hotline? Do either of you know about a hotline that people can call and get more information about this virus?
They can call us, 810-406-4246, but there's also a national hotline. Do you know what that is?
888-535-6136. And that's the Michigan.gov hotline.
Michigan.gov. Now, Kim, any parting thoughts for you?
Wash your hands. If you're ill, stay home. If you have elderly parents, make sure they have what they need to stay home for the next 14 days, maybe a month. But, watch out for each other. And
Miss Stacy Sawyer, any parting thoughts for you?
Wash your hands.
Wash your hands, she says. And folks, listen, it's been one. I want to thank, first of all of our guests for coming on. That's where it's at. I know for you to take 45 minutes out of your day on a Monday, on the first day of the week, that's a pretty big chunk of your time on a Monday. So I can't thank you enough. And listen, folks. One of the things that I took away from this is have empathy for your neighbor. I'm sure a lot of this information is a repeat from some of the things you've heard. Hopefully some of the things you've heard, you've learned from it. But the one thing I want us all to remember is let's not forget each other. Let's make sure that we care about each other because, folks, no matter what, we are in this thing together. We always have been and we always will be. And remember, this is a gospel show. I know everybody knows that, and the Bible says that no temptation has overtaken us as such, except that which is common to man. But with the temptation, God will give us a way out. Now, this is not necessarily a temptation, but we still have the same God in place, and I believe the same God that has brought us through wars, diseases, and all kind of disasters throughout the annals of history will keep us and protect us. And so let us continue praying, folks, for those of you who are out there. Continue praying for each other, praying for the workers, praying for the first responders, praying for our national leaders instead of attacking and pointing fingers and accusing and being divisive. This is not the time for that. Let us come together and encourage each other and pray for our president and pray for our leaders because we want them to be successful. We want everybody that's weighing in on this and making decisions around our lives to be successful for all of our sakes. And so, hey, thank you for tuning in to That's Where It's At. I'm your host, Stacy Swimp, where we thank Hamilton Health Community Network also for supporting That's Where It's At. And we will see you next Monday on That's Where It's At. I'm your host, Stacy Swimp.